This episode of the ABIC podcast is brought to you by Dermocosmetica. Hello and welcome to the ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we're strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is the ABIC podcast. I'm your host, Stephanie Miller, and today we're exploring one of the most overlooked yet powerful forces behind facial aging, the silent architects that shape how we look as the years go by, our bones, fat pads, and hormones. Joining us is Dr. David Kozenko, Head of Medical and Clinical Training for Dermocosmetica, and President of the Cosmetic Physicians College of Australasia. Together, we'll unpack how menopause accelerates change, why bone and fat matter as much as skin, and how new regenerative treatments such as Profhilo Classic, Profhilo Structura, and Emepelle are reshaping the way we think about prevention and long-term aesthetic care. If you're a practitioner that wants to elevate your understanding of aging, recognize the earliest signs of structural depletion, and discover how to move beyond filling space to restoring the biological environment, this conversation will give you fresh insights and practical strategies you can take straight back into your clinic. Welcome, David. How are you?
I'm really good, Steph. Thank you very much for inviting me on.
Well, I'm always very, very excited when you come on as a guest because you are a wealth of knowledge. The conversations go in unexpected directions and sometimes fun. But at the end of the day, we always learn so much and come out of these podcasts much richer for it. For those of you living under a rock and don't know who Dr. David Kozenko is, David, please do tell us a little bit about yourself before we dive into the exciting podcast we've got today.
Oh, okay. I may as well make it left of field because that's what you're expecting, Steph.
Yes.
Who am I? I'm a retired GP. So I did general practice for 30 years and I retired in November. And now I'm busier than ever. I'll just pad that out a little bit. I'm the current president of the Cosmetic Physicians College of Australasia. I'm the head of medical and clinical training for Australia and New Zealand for Dermocosmetica for both the skincare range and their aesthetic products. And I still have my aesthetic clinic, which has been running for 18 years now, nearly in Mount Eliza in Victoria. During my general practice days, the last 15 years or so of that was really concentrated on GP dermatology, skin problems that present to general practice, because dermatologists can be really hard to get into. And for whatever reason, a lot of menopausal issues, a lot of women had come to talk to me about menopause and things like that. I've got a few ideas why that might be the case, but anyway, so that's my background.
Can I ask you what ideas that is?
Yeah, look, the sad thing is I've been around for so long that I did general practice for over 10 years where hormone replacement therapy was commonplace. So using hormonal treatments for the management of menopause was something I did every day for over 10 years until everything suddenly ground to a halt in 2002. So when women decided that they couldn't go on that way, and that they needed some treatment options for the management of menopause. There was a whole generation of doctors who really knew very little about it, but that wasn't me because I had that knowledge from the past, and so it was very easy for me to pick that up, and I think the word just spread that I sort of knew sort of what I was talking about and could help them. So I think that's basically why I ended up with a lot of people coming to see me. And I should say that I always listen. I'm a good listener. I think you need to be a good listener to be a good doctor.
I love that. And you're a good listener, but you're also an incredible speaker. I am so privileged to be able to attend a lot of conferences. And every time I know you're speaking, I make a point to come and see what you have to say. It's always, no, it's always so unique. Genuinely, I'm being honest. It's very unique. It's from a different perspective. And it's always filled with compassion. And that's one thing that I think patients need so much. And we get caught up in the science behind it and wanting to do what we think is right rather than step back and think, what is my patient actually needing and wanting here? And I think you always bring that into the perspective of the patient first. So we really appreciate it. And today we're talking about something incredibly important, and it does really have a lot to do with menopause because it has to do with aging. And we're such an aging population now. We're seeing in clinic, you know, our main demographic is that aging demographic. And there's so many myths about, you know, aging and facial aging in particular. If you could correct just one widespread myth about aging tomorrow, what would it be and why?
One. God, there's so many.
All right, give me a
Um,
couple.
you don't need to drink 2 liters of water a day. It's one of my ones that I love.
You just blew
Um,
me away on that one. Really? Is it?
yeah. Um, Again, I guess that's from my medical background, especially as you get older. Depending on what your cardiac and renal function's like, you can actually make yourself sick by drinking water.
Right, yeah, you can.
And I've seen cases of water intoxication as well, which most people probably have never heard of, but um, that's one of my favourite myths. Not strictly speaking to do with aging. Um, I guess it's the thing about aging gracefully and sort of the thought that people have that they don't need to do anything about their appearance or the way they look. And I guess that's an individual decision. I mean, if you don't want to do anything, that's fine. But the fact of the matter is, there's very few of us that get up in the morning and don't have a shower, wash our hair, brush our hair, put makeup on, choose the clothing, and choose the way we want to present ourselves. And I don't see there's anything wrong with presenting the best you. That's one of the things that when I hear people say, I'm just going to age gracefully, I just wonder what they mean and what the underlying motivation behind that is. And certainly don't recommend that everyone rushes off and has plastic surgery and ends up looking strange or dysmorphic, but I don't see there's anything wrong with trying to present the best version of you either.
I love that. It comes from a meaningful place, and I think those of us in the industry for the right reasons do resonate with that sentiment quite deeply. And I know I do myself. I'm an aging person myself. I just turned 50 this year. So even though hopefully I'm doing a good job of trying to stave off the visible signs of aging, I do feel it internally. And I know that being a perimenopausal person feels different to me. And I can see changes happening in my face. I've got clients that come in and they say, no matter what I do externally, I'm feeling changes from within. My face is changing from within. Clients are noticing that on themselves. And then obviously as clinicians, you know, we understand that there are changes happening underneath the surface that aren't treatable with surface level treatments. Can you just explain a little bit about what's going on? Like which of what is happening? Which of the bony landmarks and fat compartments drive, you know, most of that visible change that we're seeing around the face? And how is it different between men and women?
Yeah, really interesting questions. I think menopause is a very drastic change in a woman's life, and women are living a lot longer now. So you live for a much longer time in the postmenopausal state. And that changes entirely the way you look at it and the way you may want to manage it. You know, in 1925, the average life expectancy of a woman in Australia was 65. Now it's 85. This is at birth. By the time you reach 50, it's actually longer. And so a good proportion of your life is spent in that postmenopausal phase. And there are changes that occur in the bones. We know that osteoporosis accelerates after menopause, and there's somewhere between a 10 and 20% loss in bone mass in the first 5 years after menopause. collagen within the skin and other tissues also decreases. So there's a 30% decrease in collagen in the first 5 years after menopause. But besides that, there's all the usual things that we have with aging that affects both men and women. You get a loss of muscle mass and a loss of strength.
Right.
There are changes in the fat compartments. So part of it is aging, but part of it is also aggravated by menopause. And I guess that's the difference between men and women. Men still have testosterone, albeit sometimes the levels decrease, but it is an anabolic hormone. An anabolic hormone is one which promotes growth and, for example, muscle mass and bone strength. And when you lose estrogen and progesterone, a woman loses her anabolic hormones. And so you often see that accelerate. And that's why you can see women as they age becoming osteoporotic and stooped over, plus all the sort of skin changes and soft tissue changes you can see as well.
You know, it's so interesting. I always think to myself, what is going on underneath the surface of my skin? You know, what bone and remodeling and fat pad shifts does a person that is, 45, 55, and beyond, what are they experiencing? And also that classic tired look, what's the difference between the tired look and that, well, no, that's just simple deflation. How does that work?
So as you get older, I always tell people you can either have the body you want or the face you want. And it's very rare to have both. So if you're carrying a little bit of excess body weight, you're going to look full in the face and you're not going to have that deflated look or that tired look. But if you've got a lean body and you're athletic, then as you get older, you start to look skeletal or gaunt. And that is when you see that tired look. Thankfully, with the right sort of treatment, we can try and get a bit of a compromise. Aesthetic treatments I'm talking about here. But what happens in the face from a bony perspective? So as you age, your bony orbits get larger, so your eyes appear to sink in. The maxillary cheek area tends to regress backwards. The chin changes as well. In addition to that, you get changes in the fat pads as well. And the fat pads, the ones that change primarily that you can see are the superficial fat pads. And initially, you tend to get deflation towards the lateral part of the face. So you get hollowing in front of the ears and in the temples. The parts in the central area of the face tend to lose volume a lot later. But that leads to a situation where you can look drawn in the middle of the face. I should say that the very first fat pads that seem to degenerate are the ones around the eyes, which is why people tend to get that sunken look around the eyes, the lines and wrinkles under the eyes as well. Plus, you get changes in the skin quality. The skin thickness decreases, the hydration, the elasticity, the firmness all decrease. And there are changes in the muscle as well. So it's really multiple layers that are affected.
In someone like myself, you said you can either have the body you want or the face you want. And I think it's true. It's definitely true. I mean, people say to me, oh, you don't look your age. And I'm like, well, it's because I have a very chubby face. And that's great in one way. But what about if you want to lose some weight as you're getting older? You're experiencing fat loss on your face. How can you tell the difference between, or give us a few clinical clues, I would say, a patient is actually losing or experiencing deep structural change as opposed to just, surface volume loss or volume loss, even in the case of weight loss?
Yeah, I tend to divide it into changes that affect the skin and the changes that affect the deeper tissues. So the skin changes, like I said before, the skin is going to feel thinner. It'll be less elastic, less well hydrated. And, a simple pinch test is a good way of sort of demonstrating that, older skin, you pinch the back of the hand and it stays up for ages. You get young skin and you pinch it, it snaps back in an instant. So they're the skin changes. Unfortunately, all of us from about mid-30s onwards get changes that primarily affect those superficial fat pads, like I mentioned before, but that's deeper. And Arthur Swift, the American plastic surgeon, has said that everyone over their life is either going to become a sinker or a sagger. A
Yes.
sinker is a person who has the volume loss towards the side, like I said, lean, athletic person, or someone who may have lost a lot of weight. Or a sagger, someone who has a heaviness primarily in that central part of the face and it tends to drag down. But a lot of that occurs because not so much because of the skin, but because of the deeper structures as well. And replacing volume loss, I mean, I think there's a real shift in what we think when we talk about volume. You know, for the last 25 years, we've been talking about volumization by way of using a dermal filler or something like that to restore volume. But what we're doing actually is putting an implant, something there to take up space. It's not actually helping the tissues. And we're seeing a shift in towards regenerative aesthetic medicine now, where we're trying to regenerate tissues. And there's a couple of ways to do it. The older way tends to involve inflammation or an immune-mediated response to stimulate collagen and elastin. The newer ways are tending to try and do it physiologically, and we're just starting to scratch the surface of that. But I think down the track, what we'll see is that we'll see people get restoration of volume through truly physiological regenerative means. And we can treat the skin as well.
Yeah.
So it'll be multi-layer, multimodal approach, I think, down the track.
I think there's so much in our future, especially with longevity and regeneration, regenerative practices as well. It's really exciting, actually. So we are going to talk about that as well, because you've got some incredible knowledge to share in that perspective. You talked to me before the podcast really quickly about a lot of people are on Ozempic, or a lot of people are focusing on their weight at the moment. And we've got this population where, especially women, you know, in later life or midlife, are wanting to look their best, feel young, and look young, but also lose weight. This is an off-script question for you. If you wanted to, if you're one of those out there that wants to dramatically lose some weight, or even lose, you know, 10 kilos, and are in that perimenopausal, menopausal phase, is there a way to be able to look at keeping volume for the face and also address skin laxity at the same time? Because I think skin laxity is this last bastion of in our industry where we're not quite got it right yet. So what do you think about someone who's out there listening and thinking, okay, I'm considering this, and that's going to be a problem for me in the future?
I think the natural tendency for a woman is to gain weight around the time of menopause, and so losing weight is difficult at the best of times. But it doesn't matter how you do it. If you're going to lose body mass, you're going to lose facial tissue as well. And I think if you want to look your best, you need to come up with a strategy that's going to address the changes that are going to be occurring in your face as you're losing weight. And so a lot of people are doing preemptive treatments whilst women are losing weight so they don't lose weight, look skeletal, and then try and restore it. They're trying to find that balance between losing the weight and still looking like they've got good facial volume. And again, I think the regenerative treatments are the best. You mentioned, I think, Emepelle before, which is a great skin treatment for peri and postmenopausal women, which will treat the skin, and it'll address things like laxity and hydration and elasticity from a topical perspective. But you can also treat the skin from within. Personally, I'm shifting away from things like skin needling or RF microneedling or fractionated laser treatments, not because they don't work, but I guess my philosophy is more towards that regenerative, physiological regeneration that you can try and achieve. And so I'm working with things like Profhilo on the skin, which you can combine with those sort of modalities as well. And under the skin, again, rather than using dermal fillers, and there's been a 30 or 40% reduction in the use of dermal fillers globally over the last year or two, moving towards things that regenerate the fat within the area. But again, trying to steer clear of those which cause inflammation and perhaps concentrating more on things like Profhilo Structura, which do it in a more regenerative way. There's no right or wrong way. It's just that philosophically, I feel that's a better way to go. And I think that's where the future is going to be. I think there'll be other products that come onto the market that'll do similar things. And I suspect that in 10 years or 15 years, we're going to look back and go, why did we always want to injure the tissue to make it better? We don't have to do that. There are better ways of doing that. So I guess I'm trying to stay ahead of the curve.
Yeah, and I think you are. I love that we're having this conversation because for a long time there, I would say in our practice, if you encounter a specific skin or if you are dealing with perimenopausal, menopausal woman, heat-based modality, I know I don't use them on my face anymore because I understand that constant heat it has its benefits, but for a specific patient, right, and in a specific area. And I'm totally with you there. I'm actually really excited to talk about Profhilo Structura, and Emepelle as well. Tell me, what's the difference? Where do you see the classic versus the Structura in treatment methods?
Sure. Just before we move on to that, I'll also say that there are some energy-based device treatments that have been shown to improve genomic expression in the tissues.
Right.
So you can achieve that with certain devices as well. And that's exciting. So I think people will head down that path as well. But talking about Profhilo and Profhilo Structura, actually, yeah, you're Italian background. Structura.
Struttura. I should
Yeah,
be able to say that very well because I was born in Italy. So,
yes. But I find that I can't say it unless I get the hand gesture.
and the struttura.
Structura makes it a lot easier.
That's so great.
Um, so, so Profhilo I look at as a skin treatment.
Right.
You know, 80% of its effect is within the skin. It is multi-level, so it does spread vertically as well as horizontally. And I say get maybe 20% of the effect in the area under the skin. Structura is the opposite, where you get 80% of the effect in the subcutaneous tissue and you get spreading up into the skin where you see improvement there. And in fact, the people that we treat with Structura, you see an improvement in the skin quality, even though we're not addressing skin. And there's been some studies that have shown there's a 23% increase in skin thickness following treatment with Structura, which is remarkable when we're not targeting it.
Insane. That's great.
Yeah. And so we're going to be we're trying to do some further studies to see what else we can measure with high quality ultrasound and demonstrate. But that's how I place them. One is really a skin quality treatment. It's a result that you can feel probably more than you can see. And the thing I like about the Structura treatments is it improves things like the jawline and the area under the eyes, but without adding any weight onto the jawline. I really struggled a few years ago where everyone was sticking dermal fillers along the jaw to try and give a defined jawline. I thought, well, at the end of the day, you're masculinizing all these women. You're giving them a heavier jawline. And I had a real problem with that. And so I never did a lot of that sort of treatment. And it's lovely to see the improvement that you can have by using something like Structura to get that improvement in jawline. So like I said, we evolve, we learn things, we see what's happened in the past, we figure out better ways of doing stuff down the track.
And so when you're actually, because you can work with both of these particular products, if you're a person that needs both skin benefits and the deeper benefits, of course, Structura is going to give you the skin benefits as well. But you can use these in combination with each other, can't you?
Yeah, there's some great combination protocols. And in fact, I'd recommend that you treat the skin from above, from within, and from one underneath as well. Because, by taking advantage of the complementary benefits of all these products, you can really see improvements. You're talking about, the skin quality is really hard to treat. I think if you treat it the right way and with multiple modalities, you can see some remarkable improvements. I do have ladies in my clinic in their mid-70s, and if you looked at them, you'd say they were mid-50s, both with the complexion, the glow of the skin, the clarity, the structure, just everything. So you can achieve some pretty remarkable things.
Dermocosmetica, masters in skin health and your trusted partner in advanced dermocosmetic solutions. Pioneering regenerative aesthetics and leaders in professional skincare distribution, Dermalogica are redefining skin quality, bringing you globally renowned brands backed by science, innovation, and proven results. With tailored education, hands-on training, and ongoing support, they empower clinics to deliver transformative outcomes and build lasting client confidence. Looking to take your clinic's offering to the next level? Partner with Dermocosmetica and access the world's most respected and technologically advanced dermocosmetic products. Visit www.dermocosmetica.com.au to learn more. A lot of clinic owners and medical aesthetic professionals listen to this podcast. They're thinking about integrating this into their treatment plans. What would it look like? What would a treatment plan look like, or what would the intervals look like? How could we integrate this therapy and put it into practice?
Who doesn't like to be told they've got great skin? That's number one. So I always think that it's really important to start with good therapeutic skincare, understand what you're trying to achieve and what you're trying to target. And then you can start working on some of the more foundational stuff. I think that all treatment plans need to be individualized. Even when it comes to doing anti-wrinkle injections, no two people get the same doses in the same places. I assess everyone individually and try and figure out what's going to work best for them. And I think with these sort of treatments, it has to be the same as well. Sometimes you're going to concentrate more on skin quality because the structure is pretty good, the support's pretty good, and you don't need to work on those fat pads as much. Other times you're going to find that you're going to have to do both, or that there's a lot of hollowing there and you want to address that, or a lot of jowling. So usually what I'd recommend is a treatment course first, which is probably going to be somewhere between 2 and 3 months worth of treatment initially, maybe 4. And it depends on what your starting point is. If you're starting from a position where you're looking older, you're probably going to need more treatments to get to the point that you're happy. Not always. Some people don't expect too much and they're happy with a little bit. Whereas if you're younger, it's a lot easier to maintain that. And so you may be able to get there very, very quickly. And then it's a matter of maintaining things. I mean, people always say, how long does it last? And my answer to that is, well, the fact of the matter is not so much how long does it last, but you are aging.
Right.
And in 6 months' time, you're going to be 6 months older. In a year's time, you're going to be a year older. And so all the things that have changed to bring you to this point in time are going to continue to occur in the next 6 to 12 months. So there will be a point in time where you go, I'm not happy with the way things are at the moment. I need to do something about it. And that's really at the time where you need to do something more. It's less about how long a product lasts as to how you age as an individual and how you see yourself and where you want to be.
I've heard some challenging information about interval times recently. How often can you have these types of regenerative treatments? What do you think is the most narrow window allowable for having those treatments? If I wanted to get a Structura treatment every 2 weeks, could I?
There is a study that was done about Profhilo that shows that you can have 7 Profhilo treatments in a year, and all that happens is that your skin quality improves. You don't get accumulation of product. It's not a filler. It doesn't volumize and it doesn't augment, but it just gives you an improved outcome the more you use it. So theoretically, with things like Profhilo, which is the one that's been had a study done about it, the more you do, the better. With Structura, it's a little different. It's got higher HA in it, a higher amount of hyaluronic acid, so it does attract and retain more water. And I could see that if you did it in a younger person, then they could end up with a lot of hydration, which may make them look a little bit puffy. And so you don't want to keep doing that. And that's why I said you really have to individualize the treatment. But theoretically, can you overdo it in the fat pads? I don't think so, because when you think about how it works, you're not actually increasing the number of adipocytes.
Right.
You're making them behave in a more youthful way. And by that, I mean they're not becoming senescent and inactive, and they're not becoming deflated. They're not losing lipid volume. And you're preventing the inflammatory cycle that occurs in the fat as we get older. So as we age and our fat cells deflate and some of them become senescent and lazy and don't work, and the precursor stem cells aren't doing what they're meant to be doing, that actually triggers a pro-inflammatory cycle. So by using something like Structura, you're actually trying to reverse that and make the tissues behave in a more youthful way. So because it doesn't volumize and augment, you're not going to create a problem. You're not going to create a fat face, for example. But why do more treatment than you need to? Once you reach a point that you're happy, that's fine. Personally, I think there was one lady that we did 4 Structura treatments in the first 4 to 6 months because she was older, and she had a great benefit after the first 2, and she could see the direction it was heading. She still had volume loss, so we elected to do another one, and then she had a booster at 6 months, I think, from memory. Didn't look filled, augmented, volumized, just looked better. I guess that's the best way I can answer that question.
That's beautiful. I mean, that's what we want. We want treatments, but we want to look like our old selves. We don't want to look like an augmented version of what we used to look like. And I think there's that limit. You've got to understand that limit between, as you said, filling with filler and then going in and actually helping the structure of the skin, and what's happening underneath. It's really important to be able to focus on the causes, and when you're talking about senescent cells, that's really the cause. Our aging is slowing everything down, and we want to boost it up. I think that's the longevity is just an under talked about in Australia future of where we're heading, especially in aesthetics as well. In terms of choosing your patients, I would suppose everybody that's aging would be the ideal patient, right? But what type of patient profiles are you kind of looking for that would be the most beneficial for regenerative support? And who's not a candidate?
I sort of flippantly say that anyone over 35 is potentially a candidate because we're all starting to show the signs of aging. But the real, trick is to determine what they need. You can't sort of prescribe one thing for everyone, and you do need to sort of tailor the treatments to each individual person. Who's not a candidate for regenerative treatment? I don't think many people would not be a candidate, but I can see situations where people have a lot of volume loss, which may be due, for example, to illness and things like that. And some of the biostimulatory treatments are definitely going to give you a better visual outcome because they're more potent at triggering collagen and elastin through the way they do it. I don't think it's as good in the long term, but if someone's got an illness and they don't like the way they look and they want to look better, you need to sort of balance it up and figure out what's the best option for them. But I guess the other people that don't do well with regenerative treatments are the inpatient ones, the ones that want to see a result now. So if you have someone that comes in and says, I've got a wedding on the weekend and I need to look better for the wedding, and they've got deflated cheeks or whatever, well, regenerative treatment's just not going to be the answer. They probably need volumization so that they can look better, whether it's the lips or the cheeks or whatever it is. So I guess it depends a little bit on the timeline as well. Does it have to be a result now, or are we talking about how things are going to progress over the next few years?
And in terms of results, how long is the timeline where somebody who's had a treatment in your clinic, when do they expect to see results from either Profhilo Classic or Structura?
With Profhilo Classic, you can definitely feel the results within a month. Within the first 2 to 4 weeks, you can actually feel it. People will often notice the hydration very quickly,
Yes.
and the glow that comes with that. But that's not the regenerative effects of the treatment. But you can certainly, by pinching the skin, start to feel it by 4 weeks. There's no doubt about that. With Structura, I think it's a lot more visible. I think if you treat someone that's young and doesn't have volume loss, you can actually see it very quickly, and they may not be happy with what they see because they don't want all that extra hydration at that time.
Right.
But someone who does have volume loss, you will see improvement very, very quickly. The
Oh,
peak effect, we usually like to see people 4 months after the first treatment with Structura, because that's when you get the biggest visual effect. It's had a chance then to start having a regenerative effect, and you can visually see that quite easily.
4 months is a long timeline for, I mean, you might not think so, but you've had a type of regenerative treatment and you keep seeing benefits and results for 4 months consistently, and then it peaks at 4 months.
Does it peak at 4 months? I don't know. There's a study that shows that it peaks at 4 months and then it sort of deteriorates. But I mean, that's the timeline that the original studies were done to demonstrate its benefit. We know that the half-life, or sorry, the longevity of Structura in the tissues is, probably close to 6 months. The studies were done on mice models, not human models, so you can't extrapolate exactly the same. But we know that it persists in the tissues for a long time, and so it's going to keep having that regenerative effect for a long time.
It's like the gift that keeps giving. It sounds like I need to hurry up and get this in my face. Um, you educate a lot. This is part of what you do through the various roles that you have. And you must see a lot of practices that you think, the science has evolved. We're so much beyond that particular teaching right now. We understand things differently. What practices do you wish that, every clinic could adopt pretty quickly in terms of, treatment methods, outcomes, patient safety, and also just general understanding of structural aging and aging in general?
It's interesting. I've seen a shift with the recent changes in guidelines and regulations, and I think people are concentrating a lot more on the consultation process. People can't advertise as much, so retention is really important. And one of the ways to ensure retention is to develop good rapport and develop your skills as a communicator and being able to make the person feel like you care about them and you're giving them a special treatment. I think there's also been a shift towards improvements in skincare too. A lot more people are interested in quality of the skin. It was a bit boring 5 years ago, but everyone seems to want to have a piece of the action now. I think doing what I do, the biggest hurdle that I find, the biggest obstacle, is that once people think of doing something in a particular way, sometimes it can be difficult to get them to think about doing things in a different way. We become, we stay in the lane that we know. We've done it for 20 years. We know how it works. We know what results we can achieve, and to challenge people with a new way of thinking about things. And this is where the regenerative aesthetic medicine comes into it, and the potential benefits in the long term is a lot more challenging than I thought it would be. I thought people would just go, well, this is fantastic. I want to learn more about it. And how do I get on board, and how do we do this? This is the next chapter. It's been a lot slower than I thought it would be. And people seem to be, I don't know whether they're more resistant, but they just don't seem to get it as easily. If you've got a dermal filler and you squirt it into a place and you see an improvement, it's very easy to understand. You don't need to understand it at a cellular or molecular level as to what's happening. You can just see it, and if you're happy, you're happy. But when you start talking about some of these regenerative concepts, you do tend to lose people. And I keep working on how to make the messaging clearer and more simple so that people understand. So that's, I guess, my biggest challenge at the moment.
Do you feel that the adoption internally in Australia is lagging behind international standards? Because I obviously keep up to date with the longevity game. I'm very much in that space and understand and look at a lot of overseas players and what they're doing. Do you think it's going to be another 5 to 10 years before we catch up with what's happening in the rest of the world?
Yes and no. I think it's patchy. There are some areas where it's been really embraced. And if I think back to the launch of Profhilo, which was before I joined Dermocosmetica, IMSA, the Italian company, had to put on a new production line for Australia and New Zealand because demand outstripped supply. So Australia very quickly and New Zealand very quickly became one of the biggest markets in the world with regards to that. But I'm not sure that people really understood the regenerative side of things and what they were implementing. It was a new product that they liked and they went with the flow, so to speak. With regards to some other parts of anti-aging, I mean, I look at this all as being regenerative aesthetic medicine is a small part of regenerative medicine and anti-aging as a whole. I think there's a lot more that can be done within the anti-aging sphere and regenerative medicine in general. And one of the fears I have is that there is a lot of noise out there. There's a lot of distraction. Whenever there's something new that comes along, people find ways to make money out of it. And sometimes that's not evidence-based, and it can become confusing for people. So that's just one of my concerns, that we're going to see people doing things that perhaps don't have science behind it, believing they're doing the right thing. So I'd like to see, and I've got nothing to do with this, this is way out of my wheelhouse, but I'd like to see, it being introduced in a way that's sensible and logical and has science behind it, and, it can improve people's well-being, their health, the way they feel about themselves, the whole lot.
I think there's a lot to be said for the changes that have happened recently in our space and elevating our practice. And I think that there is going to become a distinction, or rather the question, do you think there will, because we're heading into that regenerative space, that there will be a distinction between those practitioners that really know their stuff and they know it well because they're heading into that more scientific realm, and then the distinction between a general aesthetic practitioner that, as you said, sees volume loss and will point some filler at it. Do you think we're going to see that chasm kind of grow between the specialized regenerative expert and the normal aesthetic practice?
Look, I think those differences already exist. I mean, if we talk about menopause and treating menopause in a holistic way, including the medical and the aesthetic part, there are practices that are really trying to provide high quality advice and treatment for people with regards to that space. But there are some people that aren't on board with that at all. And but sort of still dabble in that, you know. So I think you will see polarization. I mean, I guess that's what you're asking. Um, you know, and some, like I said, some places are out to be able to provide a quick fix. And if you don't want to have a frown when you go to the races in 10 days' time, you can easily provide a quick fix for that. Or if you need some volumization for a wedding or whatever, that's possible too. But that it's not part of the long-term well-being, longevity, anti-aging side of things. I think it's separate to that. And maybe that's what I'm trying to say. I think we'll actually see a separation to some extent between the two.
I agree. I agree. And I think that's what patients are wanting. I mean, there's, this whole craze of, how does this particular celebrity achieve that look where she actually looks younger and rejuvenated as opposed to filled? And what is it that this overall holistic global rejuvenation and regeneration, where can I get that? People are wanting that type of service, and I do think that Profhilo, and then also Emepelle, I think the whole Dermocosmetica suite is very unique in that way, because it really does serve that practitioner that wants to elevate and keep up with the times and keep up with the latest research, and I think that's very special and extremely important. How do you think those regenerative treatments like Profhilo, Emepelle are changing the way we think and perceive, prevention as opposed to, oh goodness, I look old already, I'm going to go and fix this. But in terms of preventative, long-term care, are people starting this regenerative process younger?
There's definitely been a shift. Again, if we talk about menopause, you would see a perimenopausal or postmenopausal woman because she was having symptoms.
Right.
And she was unhappy with life, whether it was the sleeplessness or the hot sweats or the gastrointestinal symptoms or the mood, or doesn't matter what it was. It would always be because of something that would trigger a visit. And I think there's a lot more open discussion about it, and women are coming in saying, okay, well, I think I'm starting to enter menopause because I can feel some changes. What can I do for my skin and my cardiovascular and my bone health and all of that beforehand? And for example, if we talk about Emepelle, Emepelle's a remarkable product because it's non-hormonal. It triggers estrogen receptors in the skin, but it's not actually a hormone.
Right.
And you can start that well before you reach menopause. And it's got a lot of other good things in it, like your niacinamide, your retinols, you see. It's a really lovely combination treatment. So you can start using that earlier to help with your skin as you're going through menopause. And then as you start to see changes in skin quality, you may decide to do something more about that, or volume loss, you may decide to do something about that. But I think women are looking more at trying to prevent or not have to cope with some of the issues that their mums or older sisters had to deal with going through the menopause. They're being a lot more proactive.
I love that. I just want to say thank you so much for everything you do for the industry through CPCA, through your partnerships like with Dermocosmetica, who are also supply members of ABIC, and give back so generously to the industry always. Always learn so much from you, and yeah, we're just extremely happy to have you on this podcast. Please do come back and visit us again, because we just get so excited about the training that you deliver, and hopefully the future shows extreme advancements in the regenerative field, because it's really exciting for us. So thank you so much.
You're very welcome. Who would have thought that a podcast during COVID for something to do would have led to such a long association?
Yeah. Oh, it's been great. And the support that you've given ABIC as well through CPCA, it's just commendable. I love the fact that we can have such collaboration and symbiosis in our industry. It's a great example for everyone. So thanks, David.
Thanks very much, Steph.
Thanks for listening, everyone. You've reached the end of another episode of the ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.